Brittany. My name is Diane. I'm going to be your nurse today. I'm going to do an exam on your lower body. I'm going to listen, I'm going to look, and I'm going to touch.
Okay.
So if you could lay down for me, please. Right now I'm going to just look at your abdomen. And what I'm doing is I'm checking to see if the color is all the same coloration. I'm checking, looking at your diaphragm. It's moving up and down. It's symmetrical. I don't see any masses. Okay, and now I'm going to listen to your stomach. Let me know if I'm tickling you. Okay.
Okay.
I'm gonna hear some pops and crackles. Yep. Okay. Now I'm going to listen to your blood flow. It's cold, I'm sorry. Okay, I'm going to touch the other side. Okay, now I'm going to do a little bit of tapping. Okay, so if it's ticklish, let me know and then I'll stop, okay?
Okay.
All right. Okay, and what I'm going to do now is I'm going to touch you right here. Wait, let me go this direction. Okay, I can feel your liver. And now I'm going to check you right here. Okay, could you roll over to this side for me? I need to check closer on this side. We're good. Let me get my setting straight. This side is over here. Okay, I'm gonna turn you a little bit like this. Okay, now lay down again. Okay, now do you have any pain when I press anything right here?
No.
No pain? Okay. So now what I'm going to ask you to do is, if you can sit with your legs hanging, I'm going to check your reflexes. Okay, you ready? 1, 2, go. Okay. All right. Now, could you stand for me real quick? I just need to check something. Put your feet together and close your eyes. And don't fall. Okay, now can you turn this way for me? Go up a little. You go open your eyes, I'm sorry. Okay, can you bend down for me? Right now I'm just checking your bones, the curve of your back, making sure that it's all symmetrical. Okay, Brittany, can you sit back on the table for me? Sure. Maybe you lay down. I'm going to check your pulses. Okay. I'm going to check your pulses right here. And I'm just looking at your skin, making sure, looking at your hair. It's all uniform. Everything looks right, it feels right. Okay, I'm checking under here for your pulses. And they're really good and strong. You're an athlete, I can see that. Okay, now I'm checking your pulses right here. Okay, now, whenever I would document for her paperwork, I would document that I was able to feel her liver and it was where it should be. I was not able to feel her gallbladder or her spleen. She did have bowel sounds in all 4 quadrants. I did hear her circulation. It was in the place where it should be. Her stomach was symmetrical. There were no lesions, no mass, nothing abnormal about it. When she breathed, the rise and fall were correct. When I checked her pulses, they were equal on all 6 points that I checked. when I looked at her skin on her legs, her skin was all clear and normal. Her pulses on her toes were fine. The hair on her legs were normal, and when we did the scoliosis test, her spine was straight and her hips were symmetrical. And when we did the the test where she stood and closed her eyes, she did not sway, and she did have her reflex in her knees.